a critical moment for climate action. That's how this year's COP28 climate talks are being billed. The summit starts on Thursday with the United Arab Emirates hosting what's expected to be the biggest ever annual COP gathering. The World Health Organization is also set to lead the first ever day dedicated to health at COP. That will be on December the 3rd, as decades of progress towards better health are undermined by the threat to clean air, safe drinking water and nutritious food. Well, Diarmid Campbell-Lendrum is the World Health Organization's team lead for climate change and health. Thanks for coming on the programme. Now, Diarmid, how is climate change already harming human health and well-being?
Well, thanks for having me on. And the ways in which climate change is harming human health and well-being are diverse, and they're also very serious. So even with the 1 degree centigrade increase in temperature that we've experienced so far, we're seeing more extreme heat waves around the world, and that kills tens of thousands of people. We see more extreme wildfires as land and trees dry out and as temperatures increase. That leads to peaks of air pollution, which take lives. We see conditions improving for the spread of infectious diseases transmitted by through water or by biting insects, so diseases like malaria and dengue. It's easier to spread those now in places which had not previously experienced them. And we also see the undermining of the basic environmental determinants of health. As you mentioned, the availability of clean and safe water, the availability of sufficient food, and even the habitability of some whole nations, some small island developing nations. The final thing is that the causes of climate change, so combustion of fossil fuels, also take many lives. So we lose about 7 million lives a year, or about a life every 5 seconds, from air pollution, and a large part of that is from burning fossil fuels that drives climate change.
So what impact would you like to see health considerations having on climate policy?
Well, the first thing to recognise is this will be a historic day. This is COP28, and yet it's the first day, the first COP at which we have a dedicated health day. That means there have been 27 COPs where countries have been negotiating, and they've been actually negotiating with human lives. They just didn't realise it in many cases. So the real importance of this day, and we think this COP overall, is to make clear that as countries decide how they will address the climate crisis, how quickly they will address the climate crisis, that they take into account health as they make those decisions. Because we can make no mistake about it, if we don't address the climate crisis, then we basically close the door on a livable future for humanity. Whereas if we do address the climate crisis, this is potentially the greatest health opportunity that we've ever seen, as we shift to a cleaner, more sustainable future, or with cleaner air, more sustainable and healthier diets, and so on.
Now, I appreciate you're saying that there are gaps in some of the climate action that's already being rolled out, but something bound to be high on the agenda at COP28 is underfunding of climate action. And why do you think that's particularly the case in terms of health-specific climate goals?
There has been a real challenge, I would say, in mobilising climate finance for action in general, and many things have to happen to combat the climate crisis. We need to make that shift to renewable energy, we need to protect our food systems and so on. But one of the things that we have to do is to make health systems more resilient to climate change, but also put into place the investment so that they don't emit any more carbon than they need to. So healthcare is about 10% of the global economy, and it's about 5% of carbon emissions. Part of the problem that we've had with health not being central in these discussions is that it's become separated from climate finance. And so of the climate finance which has been mobilised, less than about 1% has actually gone to health, to protecting people from the health impacts of climate change or in supporting decarbonisation of health systems. So that's one of the things that we think needs to change.
Well, unfortunately, we are out of time. It's been a pleasure talking to you, Diarmid Campbell-Lendrum from the WHO. Thank you.